Good morning, I'm Jessica Lovell. We are live from the Dulcie Simons Jr. Family Broadcast Studio at our Olathe campus. Welcome to the Morning Medical Update World Cup Health Coverage. And joining us from our studio in KCK is my colleague and my co-host, Alexis Delcid. Alexis, if you weren't a soccer fan last night, you might be waking up one today. Did you catch the match?
What a game. Messi was on fire, Jess. That was incredible.
It was incredible. I'm really looking forward to the next one. And here in the studio today, we have two people who went to the match last night, so we'll hear more about it firsthand in just a bit.
Do they still have hearing?
Barely, but yeah, they're coming down off the high.
What? Oh my gosh, can't wait to hear what it was like in the stands. Good morning, everyone. Here at the University of Kansas Health System, we are so proud to be the official medical services provider for the Kansas City World Cup 2026 host city. And today we're talking about the demand for all the services that those people need. Our panel today is wonderful. It includes these experts from the University of Kansas Health System. We have Dr. Sarah Selby, who's an emergency medicine physician, Dr. Christopher Brown, Chief of Staff for the Kansas City Division, and Dr. Andrea DeMello, an allergy and immunology specialist, and of course, Dr. Dana Hawkinson. Dr. Hawkinson is Medical Director of Infection Prevention and Control. And Jess, we know the popularity of soccer, or football as it's called outside the U.S., has just skyrocketed.
It really has. And another thing that may be skyrocketing here at home, allergies. As we know, June is the most active month for grass pollen in the Midwest and in Kansas in particular. Earlier this month, grass pollen measured 7 out of 10 on the alert scale, accounting for around 55% of total allergens. Grass pollen is also outpacing ash pollen, which is normal this time of year as we shift from tree to grass pollens. And according to the National Weather Service, we are looking at temperatures today in the mid-90s and 35 degrees Celsius today with a heat index of 99. The good news is the temperatures look beautiful this week, and that's nice. But the bad news is that there is severe weather on tap. Rain in the forecast for the weekend, and we know that the rain and the humidity fuel more mold spores, which is also a big allergen this time of years. These seasonal allergies can be especially tough on visitors who just simply are not used to them. We caught up with some folks out and about to hear their reaction to this change underway.
Eye itching, runny nose, sneezing, the absolute worst.
So really seasonal. I would say like it gets worse around this time when it's transitioning from winter to spring to summer, like in pollen, a lot of dust, like with the wind blowing and stuff like that. My eyes start watering, they get red. I start sneezing, like those kind of allergies. It's kind of annoying. That's why I keep my allergy pills like on me, on hand, and I keep my inhalers in my purse.
I feel like for me, it's every season changes. Like if it's springtime and I get really bad allergies, and now summer's starting, so I'm like, oh, my nose is itching again. So it's, yeah. I feel like if it's windy, I get really bad allergies. Maybe it's the pollens or something. Or if it's like super, super hot, I just can't.
I think we have Dr. DeMello in Kansas City.
Oh, we know Kansas City is surrounded by agriculture. We're an agricultural hotbed, which can be a nightmare for the pollen counts, right? One thing that you've said, Dr. DeMello, is that it's important to take medications before your symptoms start. Why is that?
Oh yeah, absolutely. And you know, as you already mentioned, we're in the thick and in the midst of our high grass pollen season right now. Still seeing some tree pollens out there. Starting medications beforehand, especially if you know you have allergies, will just help prevent that allergy cascade from firing and causing you to have symptoms. If you already have symptoms and then try to take medication, not just going to be a lot harder for the symptoms to be under control while trying to prevent additional allergy exposure from causing more symptoms.
You want to get ahead of it.
Exactly.
I've heard allergists say that it's important to wear a hat and sunglasses. Why would wearing a hat help with your allergies?
You know, especially with the heat we're having, it's going to be helpful for that. But really think of it as a physical barrier. Having a hat that's like got that brim on it, wearing sunglasses will prevent you from getting those allergen spores into your eyes, into your face. It may not completely get prevent it from getting into your nose, but adding those as additional precautions are always going to be helpful, especially with your medications on board.
For people who are visiting from out of town and they might not have been expecting to feel these allergies, what would be the best over-the-counter medications that you would recommend to them?
Yeah, and the best part about allergy treatment is that most of our medications are over-the-counter, so you can walk into a grocery store or a pharmacy and just ask a pharmacist, hey, can you point me to the allergy section? Nasal sprays, oral antihistamines, all great first-line treatments to help prevent or help with symptom management of allergies.
Are there any nasal sprays that you think work particularly well if someone watching is desperate right now?
Oh, yes. Try an antihistamine nasal spray. It will work pretty quickly. It's got a fast onset within 20 minutes and will help treat those symptoms of sneezing. We heard that runny nose symptoms, that drainage. Steroid nasal sprays are also really great, but they'll take a while to get effective, so you'll have to consistently use them for a few days or up to a week before you can start to feel that they're actually working. I'd probably stay away from Benadryl or one of those first generation antihistamines.
It'll knock you out.
Exactly. You do not want anything drowsy that's not going to help you enjoy your game.
Speaking of drowsy, of course, it's the World Cup. There are celebrations. Yes. People are coming from all over the world. A lot of people are feeling tired for various reasons. How could fatigue amplify allergies?
Yeah, so fatigue won't directly cause your allergies, but say you're already coming in tired and now the allergies are getting you down, it's going to disrupt your sleep, right? Because you're going to be congested at night, you're going to be itchy at night, and now that adding in the medications that have some side effects of drowsiness is going to compound the fatigue. So stay hydrated, try to get as much rest as possible. It's going to just help, and take those allergy meds.
Something valuable my allergist told me once before we close this out is she told me, change your pillowcase all the time.
Oh.
I did that, and it's been a game changer for me.
Yes, and another one, especially if there's Fan Fest going on, people are going to be out and about trying to explore Kansas City while they're not at the game. When you come back home, so important to take that shower and just wash off all that pollen off you, and that's just going to feel great.
And then a fresh pillowcase. You're not sleeping in the pollen from the day before.
Yeah.
Dr. DeMello, thank you so much. And if you can stick around for a few more minutes, we may have some reporter questions for you or some community questions for you. Thank you so much. And speaking of questions, now is the time to send yours in if you have any. You can use the chat on YouTube or Facebook to submit your questions. And if you're a reporter, please share your name and your media outlet so we can properly identify you. Jessica?
Alexis, thank you. Dr. Sarah Selby and Dr. Chris Brown are joining us now. How are you guys doing?
Doing okay.
Doing okay. Well, you got in at midnight last night from the match. You got to tell us all about it.
I mean, it was electrifying. I mean, to be able to see Lionel Messi step on that pitch. I mean, he's one of the greatest of all times, and 70,000 people in Kansas City. The stadium was loud. I mean, 3 goals, a hat trick. I mean, that's a once in a lifetime experience.
Once in a lifetime. I was thinking, gosh, was it very similar to when you have a packed house at the Chiefs game, right?
Yes.
Electrifying.
Yeah, Dr. Selby, you both kind of drew the lucky card getting those tickets. And what was it like for you? What was that experience like for you?
We brought my whole family, so we have 2 boys, and they were ecstatic to be there, to be surrounded by so many fans from both teams. It was just amazing.
You said it, once in a lifetime. Yeah. And well, thank you for getting up early and being here with us today to tell us all about it. I'm going to be asking both of you some questions, but I want to start, Dr. Selby, with you as an emergency medicine specialist. Of course, we have our first game, first match in the books. It was it was history. I mean, we watched history. The health system is using what's called predictive modeling from past big events that we've had. And this helps really consider staffing needs and other preparations for each of these matches. So what is predictive modeling and how does it help?
So we use a lot of past experiences from all the venues that we have been working at. So we take information on the weather, the attendance, the type of event, the predicted number of people that are going to be there, so that we can predict when medical services might be needed. So we can position ambulances in the right space, enough people in the first aid stations, and so we have a lot of experience based on all of our events that we've been working at. To predict so that we can be proactive and not reactive to any medical needs.
kids.
What are typical injuries or illnesses that we see this time of year, even when we don't have the World Cup in our backyard?
Yeah, so normally we are seeing a lot of heat-related injuries. We see a lot of patients that will come in for dizziness, lightheaded, heat stroke symptoms, and then there'll be a lot of exacerbations of chronic medical problems. So we'll see a lot of heart failure, asthma exacerbations, COPD. We also see a lot of insect bites, sunburns, and injuries as well.
Well, from time to time, someone can end up in the ER, maybe playing just an innocent game in their backyard. Are we seeing more of those type of injuries, like the weekend warriors and all these kids that I see out playing? I'm just getting so excited about soccer.
Yes, yeah. So we're used to seeing a lot of injuries. Much more people are out and about in the summer, doing a lot of activities. So sometimes we see people who try to act like Messi and they go out and do too much too soon and they're not ready for it. So we see a lot of ankle sprains, knee injuries, head injuries, a lot of minor medical problems that maybe people weren't prepared for.
Maybe a little safer to watch the match than to try to emulate Messi.
Yeah.
So thinking about our first aid stations, any complaints about allergies, asthma, the heat?
We definitely see a lot of the heat-related injuries and people passing out. We always see a lot more, because of the pollen, we'll see a lot more asthma-related injuries. So people make sure to bring your inhalers when you go to these games or are out and about with this new weather. So, yeah.
What do you really want visitors from other countries to know about heading to the emergency department versus the urgent care? Because as we've discussed before, a lot of these folks in their countries, they don't have urgent care.
Yeah. So what we like to say is that emergency departments are really truly for medical emergencies, life and death situation. It's definitely where you should come if you're having chest pain, severe problems breathing, concerns for stroke or heart attacks, and major traumas. Urgent cares are definitely better if you have minor injuries, so minor cuts, bumps and bruises, joint pains, things that could be done quicker, sore throats, little viral problems. So.
And we've extended those hours, correct?
We have extended our hours quite a bit for our urgent cares, so they're available for you.
They're ready for you. Okay, Dr. Selby, thank you. Dr. Brown, you are up next. The health system has been on a call every single morning this past week or so to share information about the admissions and the impact that hundreds of thousands of people coming to the metro can have. Generally speaking, are hospitals seeing any patient care that they're linking to this big crowd in the World Cup?
I think we're kind of in the earlier stages right now. When you think about last week, just kind of looking at kind of how we were from a system base in regards to our capacity, we were functioning 100%, meaning we were full, taking care of a lot of sick patients. And interestingly enough, on Tuesday, of all days, it was nice, it was beautiful. So we really did not have that influx from an ED perspective and from an inpatient capacity. Today, we're back up again. That's what I was kind of looking at some of the numbers, what we look like. We kind of moving back towards that 100%. ED is nice and busy, both at KC downtown campus, main campus, Liberty is Senior as well. So right now, I think right now it's kind of preliminary as we get more and more humid, as we get more and more hot, we'll begin to see some of those minor heat-related injuries that Dr. Selby referred to more severe things. But hopefully everybody stays safe, listen to the education that's being provided, stay hydrated, and all the necessary things to kind of keep our fans nice and safe and be able to enjoy the game.
For sure.
Festivities.
Yeah, because we've got July looming.
Yes.
It'll be here before you know it. Mm-hmm. We can only speak to our hospital, but with last night's game and a week of FanFest, are we seeing any uptick in any other type of admissions? I mean, just in general.
So comparatively, Tuesday, we were around, just number-wise, in the 780s. Mm-hmm. Today, we're up high in the 880s. EDs are full. You all are holding it, main campus. I think Olathe is nice and full as well, being here with you today. So I can't say that we can directly correlate that to the actual World Cup, but we're definitely busy today.
According to America's health rankings, Kansas is the highest in the U.S. for heat-related emergency visits. I did not know this. The temps, as we know, have held up, but it still can catch up with you, as we've talked about that. Are we seeing any humidity-related emissions, or what you might be anticipating? You've touched on it, but what are we thinking? Because we were hearing that people are passing out, even just standing around in these big crowds. You wouldn't think that in 75, 80 degrees.
I agree. I mean, it was it's still humid, and I'm going to kind of have to work with my colleague here from an ED
Sure.
perspective. But I'm from Mississippi. I'm from the South, so I would have assumed those numbers would have related to the South and the Southwest. So it's very interesting about us being in the Midwest, but we do, as our allergy colleague mentioned, we have a lot of allergies. We kind of like in this fishbowl. So what are your thoughts about that
I
question?
think people think that they're staying hydrated and they aren't quite, so we're seeing a lot of problems with uncontrolled hypertension and congestive heart failure. So people are trying to stay hydrated but not quite doing it.
Well, as a cancer and teaching hospital, Dr. Brown, you're helping care for the sickest of the sick. And as we mentioned, we're moving closer to July, almost certain high temperatures. How might the heat impact patients who are taking cancer medications, any other medications, and just other patients with acute illnesses?
Yeah, I mean, like you said, I mean, we take care of a lot of patients. We have a lot of complex and serious medical conditions, cancer patients, you mentioned heart failure patients, and other conditions that require you to be on certain type of medications that may predispose you to be already dehydrated, where hydration is very important. And when you're out in the elements, you know, I would always advise to make sure you stay rehydrated, make sure that you find shade, you find well-conditioned places, locations, and you have to know your body. Pay attention to some of the symptoms, the dizziness, lightheadedness. If you get nauseous, that's when you need to recognize it's time to get in a safe place, get somewhere cool, and know when to call for help.
Well, bottom line, healthy or not, take the heat and humidity seriously.
Correct.
Over the next few weeks. Well, thank you both for coming in and bringing the good fun vibes from last night into the studio today. I'm so happy you both got to do that. That's such a great experience. Thanks again for being here. Alexis?
Thanks, Jess. I want to bring in Dr. Dana Hawkinson now. Dr. Hawkinson, with tens of thousands of visitors in Kansas City right now, as an infectious disease specialist, what are the viruses that are most concerning to you?
Yeah, again, I would say the viruses that are most concerning to me are those common viruses that we all know of and heard of. Things like the common cough and cold viruses. You know, there are a couple that have more of a spring-summer seasonality, but also last show we talked about measles. I would be very, very concerned if you are not vaccinated, if you are not up to date on your measles vaccine. I would be mostly concerned about measles because we know that exposure can be for a long period of time in those enclosed spaces. If you are vaccinated, there's nothing to worry about. If you are not vaccinated and you have an exposure, there is a high likelihood you could get the disease and also the complications that come with it as well.
Side question to that, is the concern that you have about measles so concerning that maybe would you advise people with babies who haven't been vaccinated yet or small children to not bring them to these events? How big is the concern you have?
Yeah, from a pure medical standpoint, again, if you're outdoors, if you are in those stadiums, if you are in those fan fests, there's probably worse things that can occur, like we just heard about heat stroke in the heat for those small children who really can't regulate their temperature very well. If you are at watch parties, that is more of a concern. Certainly we know that if your baby is 6 months or older, you can get an early vaccine starting at 6 months. That will help give protection. Mostly the vaccines do start at a year and move forward from there. But I think it's just also understanding that environment you're in. You will be certainly less likely, less at risk to get exposed in those big outdoor areas where there is that turbulent airflow and that free-flowing air.
Another question about norovirus. With these big events, we have so many people, public bathroom facilities, people are out all day, they're eating, they're sharing food. How effective is hand sanitizer in protecting against something like norovirus?
Yeah, really good question. So unfortunately, alcohol hand sanitizer is not very good for protecting against norovirus. So the best protection is washing with soap and water. Again, washing at least 20 seconds. We also want you to use soap and water for washing your hands for hand hygiene if you have clear soiled hands or particulate matter on there as well. You know, alcohol hand sanitizer is good for most things we will find out in the environment. Unfortunately, it is not very good for norovirus. So do frequent, adequate hand hygiene. Use alcohol hand sanitizer if it's available. If you can, also use the soap and water. That is going to be more effective at reducing your chance of exposure to norovirus if it is out there in the community.
There is another topic we need to hit, and that's STIs, sexually transmitted infections. This topic comes up often at huge events drawing crowds for days on end. We talk about this when the Olympics are happening in those cities. What are the STIs that you're concerned about right now?
Yeah, I know when you get people together, particularly a lot of young people, really particularly a lot of people, you know, again, we know the human species has persisted and continued to propagate for a long time. This will continue. When you get people together, things happen. We want everybody to be responsible and do things safely. Certainly we know that in the United States there is more of a surge of syphilis, so syphilis is very concerning, especially congenital syphilis. But as you get into the other smaller communities, we also know that different communities can have different surges of other things like gonorrhea and chlamydia. So those are important to understand as well. Again, we want everybody to do safe and healthy practices for everything, whether that's wearing sunscreen, you know, protecting themselves from the sun, hydrating, but also having those safe practices as well and doing it responsibly.
Hey, we want people to come here and go home with great pictures and memories. We don't want you to go home with anything else.
No.
Thank you, Dr. Hawkinson. Jessica, do we have any questions from reporters or viewers?
We certainly do. Ruth Ellen has a question. What is recommended as far as the amount of water to stay hydrated? Who wants to take that one?
I would say drink as much as you possibly can. So multiple bottles of water a day. I don't have the actual volume.
No, that's fine. Just drink a lot of water.
Drink until you don't feel dizzy or lightheaded.
Yeah.
What do you got?
And that you're peeing.
I would just echo that. I mean, the key is just making sure you remain hydrated. You know, keep a bottle of water on you. Drink enough to make sure you're not having those symptoms, kind of what we described: lightheadedness, dizziness, feeling as if you want to pass out. You don't want to ever underestimate not only the heat but also the humidity, where you can kind of lose some, you know, where you can kind of sweat, etc. So I would just, you know, I don't know the exact number either, but I would just say drink to maintain.
Well, and drink before you're thirsty. Isn't that what they used to say? Don't wait till you're feeling thirsty, because it's kind of too late. But
don't wait until you're already sitting down. And
try to catch your breath.
Trying to catch your breath and before you pass out.
Good advice. Question for Dr. DeMello. Alex wants to know, what is the most problematic allergy medication over the counter to drink with alcohol?
Probably your first generation oral antihistamines, so Benadryl. Probably don't want to be taking that with alcohol. Even your second generations, especially if you haven't had any oral antihistamines before and are now needing to take it for any symptoms, you want to proceed with caution with that. I would say if you have symptoms and you know you're going to be drinking, probably stick with like a steroid nasal spray. That'll be the safest option.
Yeah, Benadryl and alcohol sounds like sleepy time. That is
the worst.
It works, yeah. Does not sound like a good time, so be careful with that. Question, Dr. DeMello, for you as well. Stuart wants to know, can I drink alcohol while taking over-the-counter antihistamines? You kind of answered that. So is it recommended, or try to stay clear?
I would say proceed with caution. You know, your second generation ones are not supposed to be as drowsy, but just from patients using it, we know that certain ones like Zyrtec can be more drowsy compared to others. So the safest ones I would say is that cause the least sedation. So something like an Allegra would be helpful, but again, you just want to proceed with caution with those.
Dr. Brown, Joanne has a question. She is worried about World Cup traffic.
Okay.
She wants to know if she can change her doctor's appointments to virtual because of traffic concerns.
That's a good question. I would just say the majority of our facilities, outpatient clinics, they are equipped with the technology for telehealth. That does not mean that all of our physicians are going to utilize that as a means for patient care. I would just recommend, no different than any other sort of extenuating circumstances occur where you need to go from an inpatient or direct care facing encounter to maybe a telehealth. Just reach out to your clinic, have that discussion, and see if it could be arranged. I think one of the good things about it is our hospitals, meaning i.e. Olathe, main campus, and a lot of our clinics are not directly in the purview of those, of like Casey Stadium. I was getting ready to say Arrowhead, but it's called Casey Stadium right now. And you know, a lot of the Fan Fest activities. So we don't necessarily have to worry about that, but that does not mean you may not stay in those areas. And so, I would just encourage to think about that time. If it normally takes you 20 to 30 minutes to get to that clinic visit, maybe take an hour or kind of put that hour into your day to get there, and/or think about alternative routes.
Good advice. Dr. Selby, Dylan writes, I got heat stroke a few years ago. Does that make me more susceptible to it now?
It can, and mostly because it's just how your body deals with the heat and is able to regulate your temperature. So I would say if you start feeling any of those symptoms of dehydration, so any dizziness, lightheadedness, the dry mouth, not urinating as much as you normally would, to really make sure you are staying hydrated and prepare for that.
Dr. Hawkinson, Cindy's got one for you. She says, I have asthma. What other respiratory viruses are floating around right now in our area? And also, what about COVID?
Mm-hmm. Yeah, those respiratory viruses are around in the community all times of the year, certainly higher in that fall, winter period, such as October to April. But there are a couple that are more prevalent, things like parainfluenza virus and rhinovirus. Still lower than in the respiratory viral season, but higher than you would otherwise expect. Currently, we don't really have any influenza right now. The COVID circulation in the community is very low as well. We just know that those viruses do circulate at some level in the community, and different ones do tend to take different seasonality for the most part. But again, the highest rates are going to be during that respiratory viral season, October to April. But there are a few that are also circulating now. So again, it is just important to understand those pillars of public health and physical health. Know the areas that you're going to, know your environment, adequate hand hygiene with either soap and water or alcohol hand sanitizers we talked about, and also really try to avoid putting your hands in your eyes, your nose, your mouth, especially when you're out in public. That will help keep you safe from getting infected with those viruses.
All right, Hawk, thanks so much. And thanks to all of our doctors for their expertise this morning. Alexis.
We've created a series of videos for you on various topics to help during the World Cup. You can find all those videos on our website and on YouTube. Feel free to repost them or share them however you like. And we have a video right now on what to do or what not to do during severe weather, because June is considered a severe weather month in our area.
At the World Cup, bringing you the latest health updates in our morning live streams every Monday, Wednesday, and Friday mornings at 8 a.m. Join us Friday as we talk about providing health care in any language. Our experts can accommodate more than 300 languages and dialects on any given day. As we
say goodbye this morning, a big thank you to our panel of experts, and thank you to our viewers for watching. Stay tuned after the weather video for our regularly scheduled encore presentation. This episode features Patrick Mahomes Foundation and its incredible work to help people with food allergies. Have fun, be careful out there. We'll see you back here Friday at 8 a.m.
Kansas City in the Midwest is no stranger to extreme weather. I'm Andy Marshall, an emergency management specialist. I have important tips to help keep you safe before, during, and after an extreme weather event. Keep an eye on forecasts. Local media and government agencies predict the potential for extreme weather in advance. Use that time to get ready at home. In extreme heat and humidity, avoid prolonged activity outdoors. Take regular cooling breaks inside buildings with air conditioning. If you need to be outside, be sure to properly hydrate, drinking 3 to 4 cups of water every hour. Cooling towels and fans may also help you deal with the heat. Take any advisories, watches, and warnings seriously. For those unfamiliar, a watch is when the conditions are present for severe weather, but nothing has happened. A warning is when severe weather is happening or imminent. If lightning is present, head indoors immediately. Grab a weather radio or your phone to receive alerts in the event of a power failure. During a severe thunderstorm where high winds will be present, stay away from windows and exterior walls. Being in a windowless interior room will help to prevent injury in the event of flying debris. Seek shelter in a basement if possible and take your medications with you. Also, wear closed-toed shoes during severe weather events. You'll appreciate it most after a storm passes when the danger might not be over. Storm debris has sharp edges that can cut. In case of flooding, avoid areas of high water, especially when driving. It only takes 6 inches of water for a vehicle to stall and a foot or more to be swept away by floodwater.
I took his diaper off and it was just hives and welts everywhere. It did get up to, his face area, which then started the panic inside of me, and that's when we rushed to the emergency room.
I remember how scared I was and how serious it felt, and luckily for us, the doctors were able to help, and that's when, to me, it became a serious thing that I needed to really pay attention to.
That's Brittany and Patrick Mahomes describing the day an allergic reaction to peanuts sent their son, Bronze, to a hospital. Good morning. I'm Dr. Steve Stites, Chief Medical Officer at the University of Kansas Health System and Executive Vice Chancellor at the University of Kansas Medical Center. It's great to be back here with you for a new episode of Open Mics with Dr. Stites and our monthly edition of my favorite, Show Me the Science. I love that. That's awesome. Okay, food should nourish us, not put our lives at risk, of course. But for millions of people, a bite of the wrong food can trigger an allergic reaction. Research shows food allergies among children are more prevalent than ever. Today, we're exploring the scope of the problem and learning the challenges faced by the food allergy families, including the Mahomes family. Their foundation, 15 of the Mahomies, has launched a new partnership called 15 and Fair, working with the group Food Allergy Research and Education. Joining me at the desk today is Dr. Marissa Love, an allergist and immunologist here at the health system and also a board-certified pediatrician. And we're thrilled to welcome Sung Poblat, PhD, RN, and the CEO of Food Allergy Research and Education, or FAIR. Great to have you both. Okay. Now, just to be clear, son, how badly did I mispronounce your last name? I'm really good at that. Tell me, how did I do?
Pretty close. I'll take it.
All right, good enough, because that's what's going to be today. All right, the new partnership, 15 and Fair, recently hosted a back-to-school event for food allergy families. We talked with children and their parents about how they manage their food allergies. Many feel just like the Mahomes.
To peanuts. I'm allergic to gluten and I have an intolerance to dairy.
What we're allergic to, for the most part, is shrimp and fish, also peanuts, apples, and bananas.
I'm allergic to sesame, peanuts, and almonds.
How do you manage a dairy allergy at school?
I go to their nurse and he gives me my EpiPen. I self-carry and we keep one in the nurse's station, and I normally walk around with a friend at school, not by myself in case I were to react in the hallway. I have to bring my own lunch to school because in case the school lunch has peanuts in it. I get hives and my tongue swells and then my throat swells. If I smell it, it kind of makes my throat close up. It was when I was in preschool and it was like an Easter event. One of the pieces of candy that I got was a peanut butter Reese's. We went to the ER. Sometimes I don't eat a lot of my lunch. Because you're nervous? Yeah. If we were to tell a chef that I can't have it, like, don't come back with an answer, like, I'm pretty sure it's not in it, I would like a yes or a cross-contamination even counts. I forget about my allergies, and so I wish that they would be understanding, like, that I had a food allergy.
Well, Tough to watch those little kids. Those little kids have to go through that. Dr. Love, you gave a presentation at this event. What was your message to the families?
Yeah, so it was a really exciting event, and food allergies can be really overwhelming, and so being able to share the stories and give empowerment to the families and the children was most important. And I think that is something that the Mahomes family does really well and shows others that by bringing awareness, it can bring hope and help families feel less alone.
Yeah, and trust the science, right?
Mm-hmm.
I love that. Okay, now I'm going to try this again. Dr. Poblady, how was that?
That was perfect.
I see, I rehearsed this last night in front of the mirror, and then the day of right out of the game, but that's all right, You throw an interception the first time, but you still win the game. Okay, Dr. Poblady, how cool to have the Mahomes family involved. When it comes to awareness, what are some of the biggest blind spots people have?
Within the food allergy community, I think we all know that food allergy is a disease, but outside the community, many people don't understand that food allergy is a disease of the immune system, not a diet. Unfortunately, it's often viewed as a preference or a choice, and that can lead to a range of issues from inadequate funding all the way to children being bullied at school, sometimes even by adults. And food allergy moms can be viewed as Karens, and for children, they could even be seen as difficult or being fussy eaters. And at FAIR, we're working hard to build public awareness of food allergy as a potentially life-threatening disease. And we believe that shift in understanding is key to improving research funding, driving innovation, so that there are more options for the food allergy community, and ultimately enabling scientists and researchers to find new treatment options and even a cure.
Well, let's go on that one. Food allergies are getting more and more common. The survey data collected by the CDC National Center for Health Statistics shows that food allergy prevalence among children increased 50% between 1997 and 2011, and another 50% between 2007 and 2021. So the prevalence has roughly doubled since the late 90s. Now, Dr. Love, why do you think food allergies are more common in children today than in past generations? Is it awareness, or is this something that we're really seeing?
Yeah, that's a great question. We get asked this every day. Grandparents come in and they say, well, we never saw food allergies when I was this young or back in the day, and now it's everywhere. Kids' diets are different today. There's a variation in what they're eating early on in life, maybe less diverse. They're not being exposed to germs early on in life because they have a more sterile environment. And so it changes the what we call the microbiome of the gut. And so there's this idea that with us being more and more clean in our home environments, that perhaps it's changed us a little bit.
Oh, interesting. So it's not just a question of, we recognize it more often, although I bet that plays a role. It's also, there's a physiologic thing going on out there, a science thing going on out there.
Absolutely.
Dr. Poblady, what kind of research would help prove what's behind the increase? What do we need to do?
Well, I think to understand what kind of research would help, we have to understand the rise in food allergy. We need to consider the groundbreaking Learning Early About Peanut Allergy, or LEAP study, that has shown that early and frequent ingestion of common allergens can be key in preventing food allergies. This strategy, known as Eat Early, Eat Often, led the American Academy of Pediatrics to reverse their guidelines back in 2019, advocating for early introduction of allergenic foods in infants. And at FAIR, we're aware that new parents and even some doctors may not be familiar with this research and may be following older recommendations. And it's crucial to spread awareness and ensure that everyone is informed about the latest findings to effectively prevent the development of peanut and other food allergies.
Well, you know, the FDA identifies 9 common food allergens here on the screen: milk, eggs, fish, shellfish, tree nuts, peanuts, wheat, soybeans, and sesame. Now, sesame wasn't on that list until 2021. But if you cross the pond, the UK and EU count 14 major allergens, including things like celery, mustard, and sulfur dioxide. So why does our immune system mistake certain foods as dangerous in the first place? Dr. Love.
Yeah, great question. So it's very similar to a false alarm. The body sees what should be non-harmful, a food protein, as harmful, and so it overreacts. And it almost treats it as if it's a foreign body or like a virus. And so the immune system then decides to develop allergy antibodies against it. But that's usually the first step. The second step is that over time, if the patient or the person does not eat the food as much, or all of a sudden is sensitized, they can lose tolerance to that food. So if they don't eat it as frequently, they don't eat it early on in life, they lose what we call oral tolerance. And that is what becomes a food allergy. They develop symptoms.
Interesting. So what is the scientific link between allergies and other conditions like asthma or eczema? Dr. Poblany.
The scientific link is called the atopic march, which refers to the natural history of allergic diseases as they develop over the course of infancy and childhood. Classically, atopic march begins with eczema and progresses to IgE-mediated food allergy, asthma, and allergic rhinitis. Each of these are conditions that carry a complex pathophysiology involving multiple facets of the immune system. And you know, I lived in Hollywood for about 12 years before my job at food allergy research and education. And in Hollywood, you want that quadruple threat. You want to be a great actor, you want to know how to sing, dance, and you want to have a secret hidden talent. For me, my quadruple threat was the atopic march, and that's not what you want to have in Hollywood.
Well, glad you can find your way to FARA. That sounds like a little better place for you.
Yes.
So parents are encouraged to slowly introduce their kids to allergens as a way to hopefully desensitize the immune system. Now, how do you do that safely, guys?
Yeah, so and I always tell parents, you know, it's easy to overthink this. And back in the day when we didn't have as much food allergies, you just fed the baby, you know, just feed the baby early and often.
I gave my daughter those little popsicle pop-ups back in the early 90s because I was eating one and I kind of set her here to do something, and pretty soon she was eating it and she was on my shoulder. And I was like, wow. My wife didn't know that at the time because we weren't going to give our kids that kind of stuff. And then one day she put one in a bowl. She goes, look how I eat all that. I'm like, yeah, maybe she's been eating that for a while. So we introduced our kids to all sorts of stuff.
Absolutely. Diverse foods, often increasing the amount of foods that they're being exposed to on a regular basis. That all helps the immune system get trained.
Yeah. So is there any data on how effective this new, or this, maybe it's not new, oral immunotherapy approach is? I mean, we don't do this, we don't give kids the stuff in a pill, right?
No, no. And actually the only food allergen that is FDA approved for oral immunotherapy is peanut. So that is a peanut oral desensitization where you take very small amounts of the peanut protein over time, and they get to a certain dose. It helps make sure that the body doesn't overreact to small amounts of protein if it was actually accidentally ingested, but it does not cure them of the peanut allergy.
So is this anything like where people say, well, you should have dogs and cats early in life so you're not allergic to dogs and cats, or you're exposed to more stuff, you should crawl around the floor, go out and play in the mud? Is that?
That is very similar to what you're talking about for the hygiene hypothesis.
Yeah.
So, you know, the genetics, piece. Everyone's genetics sets the baseline risk, and then their environment, whether it be sterile or, you know, messy, dirty, out in the farm, decides on the expression. So I tell families that, you know, you can have this run in families, but the expression of it may be different from one sibling to another. So one might have a food allergy, the other may not.
So are researchers exploring vaccines or other immune modulating treatments for food allergies?
Yeah, that is a great question. That is very much on the frontier of food allergy research right now. And there's a lot of exciting things coming along the way for future treatments of food allergies, such as a skin patch or a tablet that goes under your tongue, or some folks are even trying to see if drops under the tongue are an appropriate thing to use.
Yeah. That sounds pretty awesome. So those are some really good other kinds of approaches that are being studied, that these could help change how we manage food allergies. So anything else besides the one you've mentioned, Dr. Love?
I'm trying to think. Those are the big ones, I would say. And the one that we actually have clinical trials running for right now in the region is the skin patch one. And then there's some oral immunotherapy desensitization trials in the region. And we do have the adult vaccine trial going on as well for peanut allergy.
Pretty remarkable. So what's the biggest challenge that still stands between current science and at least better therapy or even a cure for food allergies?
That is a wonderful question. It's a loaded question.
It is a loaded question, especially because there's a lot of stuff happening in the science world right now.
Absolutely.
You know, questions about vaccine hesitancy as well as funding for science in the United States.
I think that's a major issue, and Dr. Pobletti kind of alluded to it, is that if food allergy is not even recognized as a scientific chronic condition in the first place, then why would we spend money on it to do research?
You bet.
Why would we spend money on it to do treatment? And I can, you know, defer to Dr. Pobletti on the advocacy piece that they do on the Hill, but that is the first step.
You bet. Dr. Pobletti, let's talk a little bit about that. You talk to us from your standpoint, what are some of the biggest challenges and how can we continue our advocacy?
The biggest challenge that we see, even though more than 33 million Americans have life-threatening food allergies here in the United States, we receive less than $80 million of research funding today, compared to other disease states that receive more than $1 billion, for instance, for asthma research. It's sorely lacking for food allergies. So we have to bring more awareness, obviously, for food allergies, that it is not a diet, that this is a very serious disease that could kill individuals, and also advocate for new treatment options. One of the other things that we want to do with food allergies is to bring scientific advances in other fields. So just back in May of this year, we brought together multidisciplinary scientists at MIT, and we took a convergent approach, meaning we brought physical scientists along with biological scientists to make certain that we brought machine learning, AI, and food allergy experts. We brought GI experts. We brought immunologists from different fields to advance and amplify the learnings from multiple disciplines to the food allergy space. And from the 2 days of learning from each other, what we found was there were so many areas that apply to food allergies, and we will be launching a $10 million RFA in the next couple of months so that the food allergy community can work with multiple disciplines across institutions to quickly seek treatment opportunities for food allergy community.
You know, it's amazing to me that this seems to be still out in the public a little bit of, well, they're not really sick. That there's something wrong in their head. What's going on with that? And as someone who's experienced had food allergies later in life arise, or food sensitivities later, which I wasn't aware of, although I probably had them for years. I sympathize. This is hard. And if you can address it early and actually understand it better, I think you make a big difference in young people's lives, and you wonder how many other health conditions are linked to this question.
Absolutely. I think, you know, we've talked a lot about food allergies, but when we're dealing with adults that have food allergies, you're also dealing with adults that have other conditions: diabetes, heart disease, hypertension, kidney disease. And so you wonder, is it because you had to modify your diet early on in life that now you're at risk for all these complications?
Right. Or you didn't modify your diet and you just ignored it later. That goes back to haunt you. Oh, reflux when you're 17, you're fine. Oh, it's gluten. Who knew that? Oh, now, 50 years later, figured it out. So, yeah, you know, there are all sorts of things that happen to us. That old thing, you are what you eat. All right, Alex Delcid is watching for questions from our community. Alexis, how are you? I think I said Alex. Man, it's a tough name morning today.
That's all right.
It's my first day back, man. It's first day back.
I've been called worse.
Okay, well, Alexis.
We have a question. Well, actually, Jeremy Yenser, one of our loyal viewers, wants to share some thoughts with us on the food allergies. He writes, the anxiety of eating really resonates. We have a lot of dairy allergies and celiac in my family. The biggest surprise for me was that even checking ingredients isn't always safe, like caramel color sometimes means wheat and sometimes not, depending on the company. And some spices like oregano, if they have anti-caking agents, can mean flour. Boy, that would be frustrating. I miss the days where my family could just go anywhere and eat. Now food can feel more like a chore than something enjoyable, and food allergies really inflate the grocery bill. Dr. Love, I bet you hear that from so many of your patients.
Yes, it is heartbreaking to see people with food allergies and difficulties acquiring food, access to food, having food insecurity, and there's so many factors at play there with social determinants of health, and it can be really a difficult situation, especially for working families that have 2 jobs or don't have transportation, and they have to go to one grocery store, but they don't have the safe foods that they need, so they have to go to another grocery store across town. And so it's very anxiety provoking for a lot of families.
Jill has a question about allergy shots. Jill shares that she took allergy shots for a corn allergy as a child, and Jill writes, I'm no longer allergic, so why can't children with peanut and other food allergies take shots?
That's a great question, Dr. Love.
Yeah. So food shots actually are not as safe as we think them to be. It hasn't been proven to be safe for all populations, and so that is still not FDA approved. However, we have other agents that we can use, like the oral immunotherapy, that is the peanut desensitization, and some in research trials in the pipeline for other foods. We have the skin patches, we have the sublingual tablets that are in the pipeline, and I forgot to mention earlier, we already have an FDA-approved product for a biologic for food allergies that helps not cure the food allergy, but make life a lot easier in the sense that it reduces your risk of a severe reaction if you should accidentally eat your food allergen. So that helps with quality of life for patients. And I just had a little boy tell me that he did not want to go to school leading into this fall because he was so nervous about being around other middle schoolers and what they would say to him, and didn't want to go to the lunchroom, and you know, that can be distressing on him and the whole family. And so I said, you know, what do you think about this shot? It's just once a month. It'll help reduce your risk of a severe reaction so that we don't have to worry about going to the emergency room every day that we go to school. And he went for it, and he's so much happier now.
That's awesome. You know, science does work, right? Science does work. This has been a great discussion. Final thoughts from our guests today. Dr. Love, let's start with you.
Gosh, so I think the most important thing is recognizing that food allergy is a chronic condition, knowing what to look for. We didn't go into that too much, but learning about the symptoms of a food allergy reaction is important. And then, of course, calling your neighborhood-friendly allergist.
The neighborhood-friendly allergist, awesome. Dr. Poblete, and by the way, Dr. Poblete, we're so glad you're here in the Midwest and not in California. And thanks for the great work you and your organization do. Final thoughts.
Yeah. I want to share that FAIR offers a wealth of resources, whether you, your child are newly diagnosed or have been managing food allergies for a long time. Visit foodallergy.org to find expert information that can help guide your journey. Through our 15 and FAIR initiative, we work closely with Dr. Love here in the Kansas City area and welcome everyone in the food allergy community.
You just heard Dr. Love tell that amazing story, that young child, this one child who was having trouble in school, was afraid of going to the lunchroom, and through science gives a new shot, and he's so much happier. Faith, hope, and science. It really does work. You need to listen to people who actually do it, not to people who just talk about it. So that impact in our lives is so immeasurable every moment of every day. We have to trust each other, we have to have honest conversations, and we have to believe in the science.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now everywhere podcasts are available.